Hello everyone, now let us discuss about 2023 CPT coding guidelines for oviduct and ovary. The code range is 58,600 to 58,999. Oviduct is nothing but fallopian tube. In oviduct/ovary session, we'll have these following subsections: incision, laparoscopy, excision and repair. The CPTs for incision come under the range 58,600 to 58,615. And CPTs for laparoscopy, they come in the range 58,660 to 58,679. And for excision, the CPTs are 58,700 and 58,720, 58,700 and 58,720. And CPTs for repair are in the range 58,740 to 58,770. Now coming to CPTs for incision. Coming to the first CPT, that is 58,600, ligation or transection of fallopian tube, abdominal or vaginal approach, unilateral or bilateral. The next is 58,605, ligation or transection of fallopian tube, abdominal or vaginal approach, postpartum, unilateral or bilateral during same hospitalization. Next is an add-on code plus 58,611, ligation or transection of fallopian tube when done at the time of C-section or intra-abdominal surgery. The next CPT is 58,615, occlusion of fallopian tube by device, for example band, clip, fallopring, vaginal or suprapubic approach. And for laparoscopic approach of occlusion of fallopian tube, the CPT is 58,671. And for lysis of adnexal adhesions, we need to use 58,740. Now coming to laparoscopy. Surgical laparoscopy always includes diagnostic laparoscopy. This is a ground rule. The surgical laparoscopy always includes diagnostic laparoscopy. To report a diagnostic laparoscopy, you need to use 49320. Coming to the CPTs, 58,600. It deals with laparoscopy surgical with the lysis of adhesions, salpingolysis or ovarolysis. The next is 58,661, laparoscopy surgical with removal of adnexal structures, which includes partial or total oophorectomy and or salpingectomy, that is removal of ovaries or fallopian tubes. The next CPT is 58,662, laparoscopy surgical with fulguration or excision of lesions of ovary, pelvic, viscera or peritoneal surface by any method. The next CPT is 58,670, laparoscopy surgical with fulguration of oviducts with or without transection. The next is 58,671, laparoscopy surgical with occlusion of oviducts by device. Whenever occlusion of oviducts is performed along with laparoscopy, the CPT is 58,671. The next CPT is 58,672, laparoscopy surgical with fimbrioplasty. The next is 58,673, laparoscopy surgical with salpingostomy. And the codes 58,672 and 673 are used to report unilateral procedures. For bilateral procedures, we need to use modifier 50. The next CPT is 58,679, unlisted laparoscopy procedure, oviduct or ovary. Now let us see examples. Patient wishes permanent sterilization and elects laparoscopic tubal ligation with fallopring. Here laparoscopy, the occlusion of oviducts is performed along with laparoscopic tubal ligation with fallopring. So the CPT is 58,671, laparoscopy surgical with occlusion of oviducts by device, for example band, clip or fallopring. Here the device is fallopring. So the CPT is 58,671. Let us see one more example. 24-year-old woman presents with sudden left lower quadrant pain which does not resolve. The decision is made to perform exploratory laparoscopy, revealing a cyst on the left ovary. The cyst is removed along with partial oophorectomy. So here laparoscopy is performed in order to along with partial oophorectomy. And exploratory laparoscopy is performed relieving a cyst. Cyst is also removed additionally. So the CPT is 58661, laparoscopy surgical with the removal of adnexal structures. For example, partial or total oophorectomy and or salpingectomy. Here, partial oophorectomy is performed, and as we have discussed earlier, diagnostic laparoscopy is included in the surgical laparoscopy. This code includes diagnostic laparoscopy. That is, here the laparoscopy is performed for exploratory purpose. That is included in the CPT 58661. Now coming to CPTs for X. Now let us see next CPT 58700. Salpingectomy, complete or partial, unilateral or bilateral. Ectomy means surgical removal. Salpingectomy means surgical removal of fallopian tubes. Next is 58720. Salpingo-oophorectomy, complete or partial, unilateral or bilateral. That is removal of both fallopian tubes and ovaries. Complete or partial, unilateral or bilateral. For all of them, the CPT is same, 58720. Now coming to CPTs for repair. The first one is 58740. Lysis of adhesions. For lysis of adhesions, the reportable CPT is 58740. And whenever lysis of adhesions is performed with laparoscopic approach, the CPT is 58660. And for excision or disjunction of endometriomas open method, we need to refer 49203 and 49205, and also 58957 and 58958. And for fulguration or excision of lesions, laparoscopic approach, the CPT is 58662. The next CPT is 58750. It deals with tubuto-tubal anastomosis. The next is 58752. Tubouterine implantation. The next is 58760. Fimbrioplasty. And whenever fimbrioplasty is performed with the laparoscopic approach, the CPT is 58672. The next CPT is 58770. Salpingostomy or salpingoneostomy. Whenever an incision is made or opening is made into fallopian tubes, you need to report 58770. Whenever it is done for laparoscopic approach, the CPT is 58673. Now coming to CPTs for ovary, the first section is incision. The ovary subsection is again divided into incision, excision, in vitro fertilization and other procedures. The CPT range for incision is 58800 to 58825, and for the CPT range for excision, CPTs are 58900 to 58960, and for in vitro fertilization, the CPT range is 58970 to 58976, and finally other procedures, there is only one CPT, 58999. Coming to CPTs for incision. First one is 58800. Drainage of ovarian cyst, unilateral or bilateral, vaginal approach. And for drainage of ovarian cyst, unilateral or bilateral, abdominal approach, the CPT is 58805. The next CPT is 58820. Drainage of ovarian abscess, vaginal approach, open. The next is 58822. Drainage of ovarian abscess, abdominal approach. And the next CPT is 58825. For the transposition of ovary, you need to report 58825. Let us see an example. Patient presents for drainage of right ovarian abscess by abdominal approach. So here the CPT is 58822. And along with RT modifier to indicate the right side. 58822 indicates drainage of ovarian abscess, abdominal approach. Now coming to the CPTs for excision. The first one is 58900. Biopsy of ovary, unilateral or bilateral. And for laparoscopic biopsy of ovary or fallopian tube, The CPT is 49321. Next CPT is 58920. Wedge resection or bisection of ovary, unilateral or bilateral. The next is 58925. Ovarian cystectomy. Ovarian cystectomy, unilateral or bilateral. The CPT is 58925. Next CPT is 58940. Oophorectomy, partial or total, unilateral or bilateral. And for oophorectomy with concomitant debulking of ovarian malignancy, the CPT is 58952. Next CPT is 58943. Oophorectomy for ovarian, tubal or primary peritoneal malignancy with para-aortic and pelvic lymph node biopsies, peritoneal washings, peritoneal biopsies, diaphragmatic assessments with or without salpingectomy or with or without omentectomy. Next CPT is 58950. Resection, initial resection of ovarian, tubal or primary peritoneal malignancy with bilateral salpingo-oophorectomy and omentectomy. Next is 58951. Resection, initial resection of ovarian, tubal or primary peritoneal malignancy with total abdominal hysterectomy, pelvic and limited para-aortic lymphadenectomy. Next is initial resection of ovarian, tubal or primary peritoneal malignancies with radical dissection for debulking. Example, radical excision or destruction intra-abdominal or retroperitoneal tumors. The CPT is 58952. Whenever resection is done with bilateral salpingectomy and oophorectomy and omentectomy, the CPT is 58950. When it is done with total abdominal hysterectomy, pelvic and limited para-aortic lymphadenectomy, the CPT is 58951. When it is done with radical dissection, here limited dissection. When it is done with radical dissection for debulking, the CPT is 58952. The next CPT is 58953. Bilateral salpingo-oophorectomy with omentectomy, total abdominal hysterectomy and radical resection for debulking. Whenever all these things, bilateral salpingectomy, oophorectomy, omentectomy and total abdominal hysterectomy and radical dissection of debulking is done, the CPT is 58953. The next is 58954. Bilateral salpingectomy, oophorectomy with lymphadenectomy and limited para-aortic lymphadenectomy. The next CPT is 58956. Bilateral salpingo-oophorectomy with total omentectomy, total abdominal hysterectomy for malignancy. The CPT is 58956. And do not report 58956 in conjunction with 49255, 58150, 180, 262, 263, 58550, 58661, 58700, 58720, 58900, 58925, 940, 58957 and 58958. The next CPT is 58957. Resection, tumor debulking of recurrent. Previously they were initial resections, now recurrent resections. Resection, tumor debulking of recurrent ovarian, tubal, primary, peritoneal, uterine malignancy with omentectomy if performed. The CPT is 58957. The next is 58958. Resection of malignancy, recurrent resection of malignancy with pelvic lymphadenectomy and limited para-aortic lymphadenectomy. The next is 58690. Laparotomy for staging or restaging of ovarian, tubal or primary peritoneal malignancy with or without omentectomy. Peritoneal washing, biopsy of abdominal and pelvic peritoneum, diaphragmatic assessment with pelvic and limited para-aortic lymphadenectomy. Now coming to in vitro fertilization CPTs. The first one is 58970, follicle puncture for oocyte retrieval, any method. The CPT is 58970. And for embryo transfer intrauterine, the CPT is 58974. And for gamete, zygote or embryo intrafallopian transfer, any method, the CPT is 58976. The CPT for other procedures is 58999, unlisted procedure, female genital system, non-obstetrical. Now let us see one more final example. A 30-year-old is scheduled for surgery for right ovarian cyst. During the procedure, left ovary appeared necrotizing and the surgeon removed the cyst from the right ovary and also performed left salpingo oophorectomy. So what are the CPTs here? The first is 58925. Cyst, ovarian cystectomy for right ovary, unilateral or bilateral. It is indicated with RT modifier. And then oophorectomy and salpingectomy is also performed. So 58720 along with 51 modifier to indicate multiple procedures and LT to indicate the left side. Salpingo oophorectomy complete or partial, unilateral or bilateral. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.